Welcome. I'm excited to share a great acupressure point called GB21. The reason why it's so effective, because it directly works with the muscles that cause a lot of your pain, particularly in the neck, shoulder, and arm area. This particular point, which I'm going to share in just a second, I want to let you know that if you are pregnant, I do not recommend you to do this technique. This stimulates, obviously, delivery. So if you are pregnant, please do not do this technique. That's the first most important thing for those pregnant females. What's beautiful about this technique is that the technique helps release myofascial changes in the upper trap area, reduces headaches and actually neck pain. But what's really amazing, it takes away a lot of shoulder pain. And you're saying, how can a point back in here take away shoulder pain? Well, it does. This point's been around a long time and it's proven in Eastern medicine, and I want to share it with you because I know it works from my own experience. But the best way to locate this point, GB21, you can look at this picture right here. You can see exactly where it's located. It's on the back part, on the upper back part of the upper trap area. So you're probably asking, what's the best way to locate this point? The best way that I have found, instead of putting landmarks on the back of the neck and the shoulder, if you just know where the nipple area is, okay, and just draw an imaginary line, male or female, doesn't matter, just the nipple area, and draw an imaginary line straight up, coming over the trap area, right into the trap area, right over the clavicle to the back of the upper trap. Once you make that little hump over that trap, that is the point. When you hit that point, it's usually always going to be tender. When it's tender, you'll know you're on the right point. Now, you're always going to use the opposite arm. If it's my left side, I'll take my right 3 fingers here. I like to put my thumb in front. Just grab the front part of the trap and take these other 2 fingers and just squeeze it. So as I squeeze everything together like this, I'm taking these 2 fingers and digging into that point and holding that. And as I dig it in, I can move it around in little circular motions. If you want to release your thumb, it's okay. Like right now, I'm releasing it. And just go around in little circular motions, but you need to hold that point 1 to 2 minutes. As you hold that point, usually there's trigger points there, and you'll notice the muscle will start to get softer and softer and softer. But as you hold that point, you may even feel sensation moving to a different part of the neck, shoulder, maybe down the lower back area. But as you hold that point, it's going to release the neck muscles. It's actually going to help the shoulder on the same side. It's really amazing. A lot of people may have adhesive capsulitis or bursitis. Notice that there's pain in there, and as you hold this point right there, you say, wow, it just eased up. If you can ease up immediately 20, 30, 40%, or maybe 50 or 60%, you've done a great thing. So remember, come up from the nipple level, straight up over the upper trap area. You'll feel that point. You can see on the picture right here exactly where it's located. Once you have the landmark, you're pretty much ready to go. So hold that point, get in there. You can put little circular motions. You can squeeze it. Sometimes you could just tap on it like this. That stimulates the area. It's very, very effective. Please leave your comments below. Let me know how you did. It's kind of like a magic point. I love it. It's safe. It's very effective. Hopefully we'll get you off a lot of those meds that you're taking and make you feel a whole lot better. Share this video with others. Subscribe if you haven't so you can continue to receive more of our self-help videos. And most important, make it a great day. I'm Dr. Alan Mandel.